Good day. It's aging Maven aficionado Amy K. Gaskin and Ask Amy About Aging. And today we're talking to Dr. DeLon Canterbury of geriatrics, and we're going to talk about prescription monitoring. Welcome to my show, Dr. DeLon. How are you?
Hey, how's it going? Hope you're doing well. How are you?
I'm doing fabulous. So why don't you tell us a little bit about yourself?
Sure. I am a geriatric pharmacist and I am the founder of Geriatrics. We are a telehealth virtual medication de-prescribing company. So we don't have any pharmacy attached to us. We're pharmacist led and we believe in helping seniors get off as many pills as possible using genetic testing and de-prescribing from yours truly, a pharmacist.
That's brilliant. There's so many times that a senior goes so quickly downhill by just changing one medicine.
Mm.
And sometimes there are interactions of the medicine. So this is fabulous. I'm so glad to have you on today. So why don't you talk to us a little bit about why we want to monitor our prescriptions?
Yeah, it's so important to have a good handle of what you or your loved ones may be taking, not just to be aware of any drug interactions, but you want to know if it's really doing all it needs to be doing, especially when it comes to chronic conditions that we may be dealing with. And so seniors are more likely to suffer from some medication side effects because their bodies just don't work the same like they used to. The way their kidneys work, the way their livers work, they all slowly decrease in time. And so that can affect how well or how poorly a drug may be broken down or even cleared from the body. And so just having an idea of any medication dose changes, duplicate medications, any new side effects that may present. It could be sedation, confusion, falls. If someone's on more than 5 medications, it tends to put them at a risk of what's called polypharmacy, basically the meaning of multiple meds, and that can lead to more side effects, more issues, more hospital visits. So you want to make sure you're aware of any changes in your loved ones or yourselves as you start any new medication or stop any new medication.
Yeah, I know sometimes the side effects are worse than the ailment you take it for.
Mhm.
And so that, sometimes prescriptions are just not the answer. So what can we do to know which medicines are right for us and which medicines aren't?
So it's really important to keep an up-to-date and current list of all things a person is taking. And that includes over-the-counter medications, vitamins, any supplements, herbals, as well as over-the-counter, like minerals, even like medicated shampoos, eye drops, things that go in your skin, as well as prescriptions. All of those need to be taken into effect because there can be interactions, and you'd be surprised, but they can interact. So, one, having a good met list up to date. Two, using what's accessible to you, your local pharmacist, right? They're the most accessible healthcare provider in 90% of the country within at least 5 miles. You can go there and just ask, hey, are all these things appropriate for me to wherever you get your medicines filled? And of course, you can always ask your doctor what's going on with the meds and then kindly ask, what can we do to consider getting you off of some of them if you were to make some changes in your day to day, like it could be physical activity, food, nutrition, drinking more water. I can't tell you how much our seniors are dehydrated, so
Oh
they end
yeah,
up taking meds that
yeah.
worsen dehydration. So you'd be surprised that those lifestyle changes can lead to you taking off a pill or two.
Right. I know that like sometimes when we get older, we lose sensation. So we don't know we're hungry. We don't know
Mhm.
we're thirsty.
Yep.
And so, in certain medicines will make it even worse. So that's one of the reasons why seniors end up in the hospital.
Yeah.
Yeah.
Happens all the time. Oh
And
yeah.
then it's also important to take medicines as prescribed and on time, right? I mean,
Mhm.
you can't just take them whenever you feel like it. Oh, I remembered it now. Are there natural things that are good that don't interact with medicine or not? Like natural solutions. Like I know, like when I take melatonin, the gummy melatonins work for me,
Mhm.
but regular melatonin makes me like a zombie.
Mhm.
And then my father likes to take Z-Quil, and that makes me very sick the next day.
Yeah. It's a great question. Nothing is without some type of risk. Now, there are a couple of herbal products that just have been shown that really have no effect. But you can almost assume there's some type of side effect with anything natural or anything prescription, especially if it's done in excess. So that can always be a risk factor. But melatonin does have side effects. As much as I like it, it can cause, bad dreams, nightmares. It can cause mood swings. ZQuil has what, 10% alcohol in it. It has Benadryl in it. So that can always be a problem if you're a senior who may have any cognitive impairment or dementia. You're going to want to avoid Benadryl because it can actually worsen or mask dementia symptoms. So what seemingly is over the counter can be problematic, and that's why you can't just, take other people's medicines. You have to
Right.
make sure whatever you're getting is cleared by a professional that looks at your health condition, your age, and other relative medical factors.
As we age, a medicine that we might have been on for maybe decades, are all of a sudden could have reactions with our body. Correct?
Yeah, it is rare, but usually it can happen. Like, and I see it quite often with statins, right? People who generally don't have issues with statins, and now later in their life, they're starting to get more of those muscle cramps. And not to say everyone gets that, but yeah, it can happen. Some rashes can manifest as the body changes, just in very environmental changes that can affect your susceptibility to some of these reactions. So yeah, it can definitely happen. I will say it is more rare.
Okay. And your company is very specific because you founded it on the fact that we want to make sure we de-prescribe and do it the right way.
Yeah.
And we have what techniques do you use and what do you look for when somebody wants to do something like that?
Yeah, it's a great question. So I really like to look at what are the patient's like goals? Like, what are your life goals? What do you want out of your life? What are you trying to gain? Is it to walk again, like more steps from your, bathroom to the kitchen? Or is it, I want to start playing sports or be with people in the community? I try to align what I can shave off or potentially address as a medication side effect so that you can start having that life again. So I look first for medications that may or may not have the right dose, right? I want to make sure this dose is appropriate. If you're on dialysis versus a regular young adult, you have to make sure all the drugs are renally adjusted so that it's good for your kidneys, right? I look for medications that may be doing the same thing. If I see someone on ibuprofen and naproxen and Tylenol, I'm going to want to know, even though they're slightly different, I'm going to know what's their pain situation, right? So that's a clue that tells me maybe it's not being well managed. So duplicate therapies, drug interactions, appropriate dose, all of these things are what pharmacists are well equipped to do. But to actually start deprescribing, I want to get to the root cause of what may be going on. If someone is anxious, are we going to just throw a pill, or are we going to get to the root cause of it? They have anxiety at night and they can't sleep, or they have insomnia, or they may be something that they're dealing with a family. You have
Okay.
to be able, as a clinician, to dig deep and not just, oh, I think you're sick. Let's put you on this and see how you do in 3 months. So it's
Right.
just kind of flipping the script of what our system likes to do and provide people other options that may be aligned with what they want out of life.
Perfect. Perfect. Um, So, what is the best advice you can give to somebody if they don't have someone, a pharmacist that is like you, where they want to make sure we prescribe and get on the right monitors? Can
Mhm.
you do this from telehealth from far away, or you can only do it in one state?
I do this personally for anyone everywhere. I provide consulting advice. So treat me basically like a lawyer
Hmm.
on retainer. But essentially, I'm giving advice around how to deprescribe.
Okay.
So for you as a patient, you want to just start asking yourself, am I on more than 5 medications? That could put you at a higher risk of having polypharmacy. Am I having any side effects? Am I seeing any changes? Am I seeing any, mood swings, falls, difficulty walking? Do I feel like I'm getting worse or better with the medicine is what you want to assess. And then lastly is to always have a continuous conversation with your provider. So if you are concerned, send them a message in your e-chart or on your next visit, say, hey, I want to prioritize a med review and have them go through each and every one, not just a checklist, but just go through each one and really see if it's truly necessary.
Okay. And who's the who's the best person to do that? A pharmacist or a doctor? And I ask that for a reason, because every time my husband ends up in the hospitalist seems to like want to mess with all his medications, and then he goes home with different meds, and then he goes back to the specialists, and they're all like, "What the heck happened?"
Hmm. Yeah, good question. It's always going to be ideal to have a pharmacist do a med review. They're just generally trained in the medication profile and pharmacology. So that's our specialty. But to actually make some things happen in terms of a legal, medically supervised, like de-prescribing plan, you're going to need a doctor's buy-in to say,
Right.
yes, I think we should stop this. So I think it would be easiest and fastest and more thorough to get it from a pharmacist first, especially one who may be trained in geriatrics like
Right.
myself. But it'd be great to, once you have that plan, which is what I do, once I create this plan for the patient or review, I give it to the patient. They can say, hey, doc, here's what I think we should consider. Here's what I want to try. And the doctor has to sign off on it, basically,
Right.
for the patient to actually start de-prescribing.
'Cause-
So, yeah,
yeah. Because certain ailments like diabetes and depression meds, they sometimes can counteract each other and not make it work. And so there's certain meds that you have to be very careful of. And I've found in the past that some doctors know their medicines in their field, but they don't know the medicines in other fields. So I'm glad that you mentioned
correct.
that. Discuss it with a pharmacist and then present the options. And then the pharmacist can help the doctor if the doctor's not aware of medicines and from other fields.
So true. So true. I mean, it's true. I mean, there's no discredit to what they do. Their expertise is diagnoses, right? And they're
Mhm.
trained to treat. But the problem in our system is we're not working together at all times. We're kind of, one person says one thing and then we hope the pharmacist catches it if there's an issue. Whereas if we embed both together in the clinical decision making, we're going to avoid that trial and error and potential safe harm for the patient.
Exactly. That's one of the reasons why I got involved with this company called Family Care Space, because they have a secure portal for the family, for the senior, and in the portal, the doctors and the pharmacists can all get together and see what's happening in real time. So when they go to review the patient's chart at the time of their next visit, they can see that they had medical changes. They can see that there has been changes in the lifestyle, or the adult child can actually write a note in the system for the doctor to see, or the pharmacist to see, that there was some side effects going on that the patient might not tell you. So I think that
Mm,
keeping your care team, which is anyone that loves and cares for you, together and on the same page will help with this as well. So,
precisely.
and
Precisely. Yeah.
yeah, and next time we talk, I really want to get into this, the genetic testing you do,
Sure.
because I firmly feel that everyone should have this, especially as we age, because I know that certain medicines that one person can take, another person can't. So that's the whole philosophy behind it, right?
Exactly. Yeah, we'll definitely dig into that. But your body and your genes, they all can respond differently to drugs based on your family history.
Right. And then yeah, we'll dig more into that next time. But thank you for coming on today, and I look forward to having you on again. Again, this is Aging Maven aficionado Amy K. Gaskin, and we spoke today with Dr. DeLon Canterbury. And I look forward to speaking to you again. Have a great day.
Yeah, thank you.